Good afternoon, and thank you for joining us. Today is Tuesday, October 5th, and on today's briefing, we'll hear from Mayor Tom Barrett, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Darren Rausch, Health Officer and Director with the Greenfield Health Department. Thank you all for being here, and Mayor Barrett, I'll hand things over to you today.
Well, thank you very much, Catherine, and good afternoon, everyone. I think a good place for us to start, as we usually do, is with our COVID-19 gating metrics. So I'd like to provide an update as to where we are. Unfortunately, we remain in the extreme transmission category for COVID-19 cases per 100,000, down to 241 per 100,000. Last week, we were at 323 per 100,000. So again, I'd say that that is an improvement. We're down, and that's exactly what we want to do. Our percent positivity rate remains in the substantial transmission category. Again, this number is down. It's down to 8.4%. So headed in the right direction, knock on wood. Let's just keep it going. In terms of our vaccination rates, 56.6% of City of Milwaukee adults, individuals 16 or older, are fully vaccinated, and 62.1% of adults have received at least one dose. We can do much, much, much better than that, and I hope that we do. It is promising to see our numbers begin to drop after a number of weeks of increasing cases, but we also recognize we must continue to exercise caution as we remain at these high levels of disease burden. And no surprise to anybody, increasing our vaccination numbers will help us to continue on this path of decreased spread. So the answer is always the same. This is not a trick question. The answer is always the same. How can we help fight this? The answer is vaccinations. And to that end, the Milwaukee Health Department continues to offer free vaccinations at its Northwest and Southside Health Center locations. I was just at the Southside Health Center last Tuesday, a week ago today, getting my third shot, and it was as easy as pie. So again, nothing to be concerned about, no bad impact, no bad effects, was in and out in less than 5 minutes. Tomorrow, October 5th, we'll have shots available from 10 a.m. to 3 p.m. at the UWM Union. On Wednesday, from 1 to 4 at Ascension All Saints Family Health Center, from 2 to 4 at the COA Golden Center, and from 3 to 6 at MATC Walker Square. On Saturday, October 9th, from 9 a.m. to noon at El Rey on the south side, and flu vaccine is also available at this location. Last week, it was announced that booster doses of the Pfizer vaccine are now available for eligible individuals. I want to remind the public that if you fall into any of the following categories, you should receive a booster dose at least 6 months after receiving your second dose. If you are 65 years of age or older, if you are a resident of a long-term care facility, if you are between 50 and 64 years of age, and you have certain underlying medical conditions, and you can talk to the medical providers to determine whether you fit into that category. Other eligible groups that may receive a booster include those 18 to 49 years of age, again, with some underlying medical conditions. Check with healthcare providers, see if you fall into that. And those 18 to 64 years of age at increased risk of exposure due to their job or institutional settings. This includes jobs like frontline essential workers and healthcare workers. The Milwaukee Health Department does have these shots available at both our Northwest and Southside Health Centers. Lastly, but certainly not least, our Milwaukee Brewers will be entering the playoff games this weekend, and we are very, very proud of them. It's a great year for sports in Milwaukee, and we want to continue that. That's going in the right direction, and we want to continue to have that go in the right direction. But if you're planning to attend any large watch parties or even the games, protect your individual health by being crowd aware. Consider wearing a mask both indoors and outdoors, certainly indoors, but consider outdoors. If you have not yet, go get vaccinated. And a full list of vaccination locations, and there are many, is available at healthymke.com. So with that, I will turn it over, I believe, to Dr. Weston, if I'm not mistaken. Dr. Weston.
I think that's right. Thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 314 new cases per day and about 4 deaths per day. And we're seeing a slow but sustained decline in positivity rate, now nearing 8%. So while COVID hospitalizations remain steady and deaths continue to rise, we would expect a maintained downtrend in that positivity should result in decreases in both of those categories in the coming weeks. Now, maintaining that promising trend will depend on personal mitigation measures, masking, distancing, and ventilation, of course, as well as vaccination. Now, in the absence of County Executive Crowley today, I'll share a few updates regarding the vaccine mandate for Milwaukee County employees. So as of last Friday, October 1st, all county employees who are not members of public safety unions were required to submit documentation verifying their fully vaccinated status or a completed medical, religion, or creed exemption and accommodation request form. So the number of Milwaukee County staff impacted by this administrative order is approximately 4,059. So that includes Milwaukee County Transit System staff, as well as departing seasonal parks workers. So what our data shows is that 2,996 employees have submitted proof of vaccination or an exemption request. So that's about 74% of our staff. Now, of those, 58 employees sought medical exemptions and 260 employees sought religious exemptions. Of the 26% of employees that did not yet submit proof of vaccination or an exemption, about 30% of those are with the sheriff's office, and now they have a different process, a different timeline for vaccine requirements. Now, in order to mitigate the spread of COVID-19 in the county effective October 11th, all unvaccinated employees, including those with an approved exemption, will be subject to the following additional risk mitigation measures. So first, unvaccinated employees working in any county healthcare setting will be required to wear a fitted N95 mask when a face mask is required. Second, unvaccinated employees working in person in non-healthcare settings would be required to wear a KN95 mask at times when a face mask is required. Third and last, unvaccinated employees working in person, full or part-time at the House of Corrections, at the county jail, or the DYFS detention center would be subject to COVID-19 testing on a bi-weekly basis. And that's consistent with current policy, in addition to being required to wear a KN95 mask. The current administrative order defines a completely vaccinated person as an individual who's completed either the 2-dose series of Pfizer or Moderna, or the single dose of the Johnson & Johnson vaccine. So it does not include any booster vaccinations at this time. And on this topic, we're increasingly seeing the value and effectiveness of vaccine requirements in the workplace. These requirements keep employees safe and workplaces functioning without the constant interruption of quarantines and isolations. And it turns out they work. United Airlines, one of the first companies to have a broad vaccine requirement, recently reported that 99% of their workforce has received the vaccine. And we've seen substantial increases in vaccination rates at places like Tyson Foods, at Fox News, in the military, as well as universities and health systems across the country. And as we've seen in schools for decades, these vaccine requirements work to protect not only the individuals, but their communities as well. We recently saw news of the initial results of the Merck trial for its oral antiviral COVID medication called Molnupiravir. Now, I'm sure an easier name is coming soon. In their trials of a little over 700 people with mild to moderate symptoms from COVID, they found that the drug decreased the rate of hospitalization and death by 50%. Now, what's remarkable about this treatment is that it is oral and can be taken at home. And Merck stated that if it received emergency use authorization from the FDA, they could rapidly manufacture a large supply of the medication and provide lower cost pricing to lower income countries. Now, this is a potential game changer and could certainly alter the landscape of COVID disease globally. A 50% reduction in hospitalization is excellent. Now, that said, it's worth remembering that we already have something that reduces hospitalization by more than 90% and also reduces the chances of getting the virus to begin with. And that, of course, is the vaccine. The vaccine remains as critical as ever. Not only is prevention of illness important and better than treatment, but the vaccine is far cheaper and also dramatically cuts down on transmission of disease. The treatment was also shown to have its effect when given early in the course of disease, not once someone is already in the hospital. Now, nevertheless, this is a valuable addition to our arsenal in the fight against COVID. At-home treatment of mild to moderate illness to prevent progression of disease would be a critical step to avoiding hospitalizations and deaths. In other news, we saw an update from the FDA's advisory panel on their scheduled discussions this month. On October 14th and October 15th, they'll discuss booster doses for individuals who receive the Moderna or the Johnson & Johnson vaccines. This is a welcome discussion for individuals who fall into those two groups. Now, there is compelling evidence for both vaccines that a booster dose may significantly bolster immunity. And next up on their agenda on October 26th, the FDA panel plans to discuss authorization of the Pfizer vaccine for 5 to 11-year-olds. And this is welcome news to many parents of young children who've seen a very confusing timeline of vaccine authorization for young kids. This timeline, this scheduled meeting, maintains the hope that shots could be in arms of 5 to 11-year-olds by the end of October or very beginning of November. And as we continue to see a third of cases of COVID in the county among children, being able to vaccinate 5 to 11-year-olds could have a significant impact on transmission as well as disease burden, while keeping many young children safe from short-term as well as long-term effects of this disease. Thank you very much. Stay safe, and I'll hand it to Health Officer Roush.
Thank you very much, Dr. Weston. It's my pleasure to join today from the Greenfield Health Department. Just a few comments today I want to make are talking about cases overall in the Milwaukee area, and I also want to talk about laboratory testing. But let's start with cases. And I want to reflect that while the national news media stories have been really focused recently on decreasing case rates for COVID-19, that has not been our reality quite yet in the Milwaukee County area. Much of the national picture has been driven by those southern states that started with stronger outbreaks earlier in July and August than we experienced here. Those states have now returned to nearly pre-wave case levels, but those case levels still remain pretty high in those states. In our area, the reality is cases are still very elevated. We had seen an elevation in cases a few weeks ago, and we remain at that elevated plateau even within the last week. We'll see what Thursday's data shows, but we have been elevated more recently. Our case burdens in terms of our 7-day rates, when we look across the entire population, is similar to what we saw between December and January. Very high rates of disease. And it depends a little bit whether you're looking at just the city of Milwaukee numbers versus the suburbs collectively. One thing I noted last week is that the 7-day average for kid cases, those under the age of 18, were the highest for the city of Milwaukee all time on September 14th and still remain high overall. So I encourage all of you that while the national reports are showing cases are declining, we can't quite take our foot off the gas at this point. We need to continue all of those layered mitigation strategies, including getting tested, because disease is still quite rampant in the Milwaukee area. So obviously with increased testing, or with increased cases rather, we have increased testing burden. And laboratory testing is the best way to know your COVID-19 status. But this demand for testing related to outbreaks in schools and workplaces and families has certainly created some delays. Testing that we used to get results back in 24 hours or maybe even less has been delayed more recently. We are seeing in general laboratories across the Milwaukee area that are doing testing, the PCR-based testing, their turnaround times have extended. They're no longer being able to report in 24 hours, maybe it's 24 to 48 hours. Again, that's a very good turnaround time for any sort of diagnostic laboratory test, but it certainly does put burdens in the community. So for that reason, public health is continuing to explore other options for testing, and there have been many options for testing that have come on recently. Just to give you some context where we are at for testing volumes, we haven't seen testing volumes this high since last fall and into the early part of the winter in 2020. So a period of time between October 21st and December 16th was higher in terms of testing burden than where we're at now. For those 3 weeks, or for that time period, 3 specific weeks had testing volumes of almost 50,000 tests. Currently, we're only averaging for the last 3 weeks about 37,000 tests, but you can certainly see that demand has been higher than we've experienced in the past. So some of the new testing options that have come online are really seen quite well when we look at children's data. Specifically, we're testing at least 6,000 to 7,000 children each and every week here in Milwaukee County, largely because of an effort between the Department of Health Services at the state level, connecting laboratories to schools and school districts throughout the state. Many of the school districts in the Milwaukee County area have already started those agreements or are in the process of starting those agreements here in the county. And this laboratory testing can provide that diagnostic assessment of COVID status for those kids, which is very helpful for families in relation to a symptomatic child or a child that has been exposed and who's now looking to get out of quarantine at the end of their quarantine period. So this has been a great option. It's an option that didn't exist in the prior school year. And it's certainly one reason that we're getting some good quality testing opportunities for our kids. And just kind of in summation about testing in general, just want to remind everybody, you may have to wait a little bit longer for testing, but testing is fairly readily available throughout the Milwaukee area. And we're certainly looking to continue to provide valuable and rapid diagnostic testing as much as we can. But just remember, that might still take 24 to 48 hours. With that, I'll turn the media briefing back over to Catherine for the question and answer portion.
Thank you, Director Roush. Our first question comes from Vanessa Swales with the Milwaukee Journal Sentinel. She's wondering, for Dr. Weston, could you provide the number of county employees who have not gotten vaccinated and also not requested a vaccine exemption? And can you talk a little bit more about the repercussions and timeline for those county employees who have decided against getting vaccinated?
Sure. So 1,063 employees, that's about 26% of the workforce, have not submitted proof of vaccination or exemption form yet. October 11th is when other mitigation measures would go into place. So we're still working with department leaders and those employees to get their proof of vaccination in. As far as the repercussions of not being vaccinated, there's a stepwise approach. We could certainly share that document, but some of it includes mitigation measures to decrease the spread of disease within the county.
Thank you, Dr. Weston. Our next 2 questions I will blur. They're for the mayor. They're wondering about, are there any updates on the testing facility to replace the one at American Family Field? And then Kent Wainscott is wondering, is the plan to buy or lease the facility, and what is the holdup in the negotiations?
Well, it's my understanding we do have a site that we are very, very interested in, and we are working out the legal ramifications or the legal subtleties of, my understanding is leasing the operation, but we don't have anything to announce today. Again, we have to get through the legal negotiations. As soon as we have those resolved, we will make an announcement, a public announcement of the site.
Thank you, Mayor. Our next question comes from Jessica Mudiker with TMJ4. Perhaps Dr. Weston or Dr. Roush, you can chime in. She says, as we head into colder weather, what are the concerns regarding our homeless population and COVID? Is that population disproportionately affected by the virus? And are there plans to deal with helping homeless individuals in different ways, like the city did last year because of the Delta variant? And certainly Mayor, chime in too, related to the city.
Certainly. So the county, the city, the municipalities all have programs in place to help their homeless populations. Now, specific to COVID, we worry about homeless populations, particularly when they enter shelters. We know these are high risk areas for transmission of disease. And so ensuring vaccination as well as other mitigation measures in shelters, among shelter staff, and among homeless populations is going to be critical.
And I'll simply say that this is an area where I think the city and county have worked particularly well together, the continuum of care model, working with local hotel operators to make sure that we have places for the homeless to be and doing everything we can to get them the vaccination. So as implied by the question, it can be a challenging population because people are almost by nature transient. But I do think this is an area where the city and county have worked well together.
Thank you both. Ben Wagner with WISN 12 is wondering, Dr. Weston, related to the COVID-19 pill, how is this drug different than others treating COVID-19?
So one of the main differences with this drug is that it's oral and that it's taken with mild to moderate disease. So this is something where you first test positive with COVID. If you have certain symptoms, you could go ahead and take this and prevent hospitalization and certainly prevent death. A lot of the other medications we see, other antivirals, steroids, monoclonal antibody treatments, these are typically medications that are given when you become more sick, when you're in the hospital. And so this is earlier, more proactive treatment at home.
Thank you, Dr. Weston. Diane Bezchuk, I'm sorry, I can't recall the exact outlet you were with. All right, well, I'll move forward. You can chime in here. Sorry about that. Dr. Weston or all, a report released today by the U.S. Department of Wisconsin Public Radio, fabulous. A report released today by the U.S. Department of Health and Human Services links vaccines to preventing 5,500 new COVID-19 cases, 2,200 hospitalizations, and 700 deaths among Wisconsin seniors from January to May 2021. There are promising numbers for vaccines. What are your thoughts on this data? Do you think this will encourage more people in Wisconsin to get vaccinated?
So I think these are promising numbers. And these numbers, as you mentioned, are January to May. We still have several more months when we saw a spike and we saw a significant increase in hospitalizations that haven't even been counted here. So I think this is an additional layering of good news for the vaccines. And we've seen story after story, study after study of promising news. Look, in the end, these are some of the most, if not the most, safe and effective vaccines that have ever been developed. And the more people that can embrace them, the more we can decrease our disease burden and the more we can get back to normal.
All right, thank you, Dr. Weston. One more question here for Dr. Weston. In your opinion, how soon can we expect to see both Moderna and Johnson & Johnson vaccine boosters approved and available here in Milwaukee?
So the FDA Advisory Committee will be meeting on October 14th and 15th for Moderna and Johnson & Johnson to talk about the boosters. Of course, we'll see what they say. We'll defer to their judgment. But I think the evidence is good that boosters, especially in certain age groups, especially in older age groups and people with medical conditions, much like the Pfizer vaccine, that it can be really helpful and that it can increase their immunity, prevent not just getting disease, but also prevent hospitalization and death. And so I'm hopeful that those 14th and 15th of October meetings will be promising. And shortly after that, we've seen an expedited timeline for how the CDC responds to what the FDA is saying. They're not wasting any time. They're not cutting any corners either, but they're not wasting any time. And so I'd be hopeful that potentially by mid to late October, we could be seeing boosters for both of those vaccines.
Thank you. All right. That does look like those are all of the questions in the chat. Thank you all for joining today's briefing, and we will see you next week.
Thank you.